Hello, Nadia Niang. We talk about opioids and how the epidemic that affected healthcare. Opioids are used as a pain relief or to feel euphoria. There's a natural opioid, semi-synthetic, and there's also synthetic like morphine, codeine, and poppy plants. Here you can see on my slide oxycodone and was used, and to the right, all the different medicines that are used in the medicinal healthcare society to treat acute pain or pain management, which are chronic pain, or different things like diarrhea relief or intestines. So shifting to pain medication and how it's being misused, it is now the leading cause of death under 50 years old. It's because it was a fail-safe. A lot of people like Purdue have said that it was safe to use as a pain reliever, and they've later now retract that, or the drug award being so addictive to the body, or anxiety, stress, and pressure, without it being like a craving, and they can't get enough of it, and they can't live without it. Another reason the misuse of drugs is the overprescription of opioids. Doctors have been seen more likelihood to overprescribe opioids if they have toothaches or gastrointestinal system problems, and knowing that they will have a hard time getting them off of the medicine, so they keep prescribing them so they have more money in their pockets. The opioid crisis is a great killer within the American system. It affects rural, urban, and every socioeconomic class. And the drug overuse and overstimulating makes it for the spread to be more faster and on a larger scale. Overdose is common when using opioids. Opioid overdose is when a person takes the higher amount of drugs that the body can handle, and it makes them discolored, or they have shallow breathing. When using opioids, it's usually that they've switched to more higher drugs like heroin, and it affects their body as well and causing them to overdose. Unfortunately, like in the movie, there are no solid treatment for opioid crisis. But if we teach at a younger age, people will be more aware and more likely to stay away from opioids, or having rehabs or open community groups that, like TikTok said, that you can talk to people instead of relying on drugs when you're in pain or treatment, because pain is normal. Other methods that can be used instead of opioids or massage therapy, other medicines like Tylenol, or that can be used for pain medicines or medicated cream or physical therapy. By looking at my references and all the other sources, it can be concluded that misuse and overprescribing is very popular within the American healthcare system that causes the death of many people and patients that use opioids, for example, like Michael, who was medicated with 185 medicines when in the short 1 month period of him having Crohn's disease.